Should prisoners in Wisconsin be eligible right now to receive the COVID-19 vaccine, while the general public might not be able to get in line until May?
Some say yes, others say no. NBC 26's Kelsey Dickinson has multiple views tonight.
Kevin Cook spent 2 years inside McNaughton Correctional Center in Oneida County.
I was there from January 9th of 2019 till December 7th of 2020.
Part of more than 2 decades behind bars for his role in a gang-related homicide back in 1994. At McNaughton, Cook experienced firsthand what it meant to be incarcerated during a pandemic.
COVID just spread like wildfire throughout the whole center.
Cook says that it was September when an inmate at McNaughton tested positive.
That started an avalanche. In one unit, the inmates there, they have to share a bathroom. They have to share the showers. They have to share everything. And there is no way to avoid contact.
Cook says those inmates were isolated in their unit, but he says it didn't stop the spread.
And it's really spreading.
The DOC reports there have been 71 positive COVID-19 tests at McNaughton since mid-March. Cook says he was one of them, saying he tested positive about a month after his cellmate developed COVID-like symptoms.
I had to stay in the room with my cellie, and as a result, I tested positive.
DOC policy is to medically isolate positive cases and quarantine persons exposed, a challenge when case numbers increased in the fall.
Prisons aren't designed to have large separate areas for people, right? It's not designed to be like have a large quarantine or area.
Peggy West Schroeder, a prison reform advocate, believes the challenge goes further.
Our prisons are overcrowded.
The latest reports show original capacity at McNaughton is 55. The facility currently houses 94 inmates.
When you're living on top of people, there's just simply no way that you can protect them.
Inmates can be vaccinated, but that plan is controversial. Incarcerated individuals in Wisconsin are part of the current COVID vaccine eligibility group.
Let's make this about who actually needs to be vaccinated. It's for public safety for your community. If COs are bringing in the virus to a facility and people in their care get that virus, they're then passing it on to other people who work there, who then come back and bring it back out into the community.
Not everyone agrees.
I just don't think that inmates should get a fast pass to the front of this line.
State Representative David Steffen proposed a bill that would do the opposite, making it so inmates younger than 60 would not qualify for the COVID-19 vaccine until 21 days after it's available to the general public. The bill's in committee now.
It comes down to some simple elements. One is a very simple question, is should a murderer of 3 get a vaccine ahead of a mother of 3? I think it's a very simple way to look at this entire situation.
Cook says he was released COVID positive on December 7th.
Nurse, she informed me, she's like, I'm sorry to inform you, but you tested positive for COVID.
He says he had a mild case and went to an apartment to quarantine. But Cook says he would like to see inmates vaccinated. We asked him when he thinks prisoners should be in the vaccine rollout.
Whether that turn is now or later, please just make us human. Don't put us in a category of you are not our priority.
As of now, prisoners remain ahead of those with certain medical conditions and members of the general public to get the COVID vaccine. Kelsey Dickinson, NBC 26.
Our thanks to Kelsey for an in-depth look tonight. And as of today, the DOC reported more than 30 active COVID-19 cases across its 37 institutions statewide. The total number of cases in state prisons now reaches nearly 11,000 since mid-March of last year, and 25 deaths during that time. Overall, Wisconsin has seen more than 6,500 COVID-related deaths. Again, that's overall, counting all of Wisconsin during that same time.